everyone, welcome back. Ken Vitale here, and welcome to something different. Students often ask me for more ways to test themselves, but let's be honest, multiple choice questions can be a little stale. So I thought, well, let's make it a little more fun and maybe even a little high stakes. So gonna turn that down. So welcome to Who Wants to Be a Millionaire. Probably you're familiar with this, but it's a game show style in PowerPoint. You work your way through 15 questions, from the basics all the way to board exam level challenge. Today's topics is a mix of dermatology, rheumatology, and orthopedics, which is typical of what I teach here in the medical school. But it is good for anyone studying for the USMLE and for the pre-meds out there who are curious about how clinical reasoning really works. So, as you play, track your progress and see how far you can go. Hopefully you can make it all the way to millionaire status. So let's get started. And again, if you enjoy this content and this format, I've got more rounds coming from everything from cardiology to physiology. So get ready, grab your pen, and let's play. Okay. All right, intense already with the music. A high school wrestler presents to the athletic trainer with an acute painful outbreak of grouped vesicles on an erythematous base on his shoulder. Another wrestler on the team has a cluster of red scaly patches with honey-colored crust on his face. Which of the following pairings correctly identifies the likely infectious agents for these two athletes? That means you got to get them both right. You got to pick the type of lesion and the offending agent, virus or bacteria. And, well, pause it if you need to figure it out. And when you unpause, here we go. All right, there you go. So painful grouped vesicles, herpes simplex virus. Here is the explanation. Just a quick point here. This is herpes gladiatorum. This is different from tinea gladiatorum. And it's also different from tinea corporis, ringworm, or athlete's foot or jock itch. All important things to know when you're dealing with a high school athlete. Now we move up. All right. So, next question, we have some media here. A 32-year-old man is brought into the emergency department by ambulance after falling from a ladder. His vital signs are stable, he is fully alert and oriented, and he reports having no past medical problems. He is in excruciating pain, as you can probably see from that x-ray, which he states is located in his left arm. If left untreated, which of the following muscles is at risk for losing function due to this specific injury? Give you a moment to review it. Pause if you need, and there you go. The FCU, flexor carpi ulnaris. So what's going on here is they have a distal humerus fracture, which is very common. And if you know your anatomy here, we have the median nerve, which comes down the front of the arm, the radial nerve, which also comes down the front, but the ulnar nerve comes down the back and the side, and this is very much at risk for getting injured in the medial epicondyle area of a fracture. You can read further if you want a little bit more information on that, but there you go. Moving up. Okay, a 16-year-old gymnast presents to the emergency department after landing awkwardly on her on her ankle after dismounting from the parallel bars. She reports that she felt her ankle roll inward, essentially inverting her ankle because of a misaligned axial load. On physical exam of the injured ankle, there appears to be a forward displacement of the talus. Which of the following ligaments has she most likely injured? Pause if you need it. Yeah. That's the ATF. So this is a very common injury, the inversion sprain. This is typically called when we do the drawer sign or the Taylor tilt, and we're checking for injured ligaments. These are graded in a level of severity from a simple sprain to a partial tear to a complete rupture. Further info there, but we're going to move on for the sake of time. A 7-year-old child falls onto an outstretched hand. A fouche, fall on outstretched hands. So this is a pediatrics case. An x-ray of the distal radius shows wrinkling and impaction of the bony cortex on one side. The fracture does not extend through the entire width of the bone. You're going to have to use your imagination here. The bone is stable but slightly compressed at the metaphysis, which is a little bit farther towards the edge of the bone. What is the most appropriate name for this common pediatric fracture type? Pause if you need it. That's a buckle. It's a torus fracture. So the key terms here is that wrinkling and impaction at the metastasis, and that's what a torus fracture is. There are other names that are out there. A green stick fracture, that's on the tension side instead of the compression side. There are other ones, Salter-Harris, that's a growth plate fracture, and bowing is just when you bend it, but there's no actual visible fracture line. All right, question number 5. A 57-year-old automotive factory worker with no significant past medical history reports to the clinic complaining of weakness and pain in his right shoulder with any movement. He says that for the past 2 weeks he has had trouble lifting his right arm above his head. He reports using his left arm to lift his right arm slightly, and then he can lift his right arm the rest of the way up without help. That's a key sentence here. Which of the following muscles is most likely injured in this patient? You might recognize some of these muscles. There are a lot of the muscles of the rotator cuff here. Pause if you need it, and the answer is supraspinatus. It's the most commonly injured one. Supraspinatus is when you initiate abduction in the first around 10 to 30 degrees. Some people say it's exactly 15. It's a bit of a range. And then your deltoid helps take over as you bring your arm all the way up overhead. All right, we made it through the first 5. A 17-year-old boy presents to his pediatrician with pain in his right leg. Biopsy reveals malignancy, sadly, in the distal femur. We do see this a lot. He has a family history of, quote, eye cancer in his younger sister. Which of the following is the most likely diagnosis? This one's getting challenging here. We're moving up in the money amount here, so things are going to get a little more difficult. Pause if you need it. And this is, unfortunately, osteosarcoma. So these are very common. This osteosarc, as you can see, is the most common primary malignant bony tumor, very commonly in males and in kind of that middle age range there. You can kind of review the rest of these. They are all important to know and distinguish. Fortunately, there are some ways to predict and distinguish which one of these are likely going to be. Interesting point here, osteochondroma is very different from osteosarcoma, even though they might sound the same, because those are completely benign usually. Same thing, enchondroma sounds also like a bad thing, but it's also quite benign and very common as well. Osteosarcoma is not. Right. Next one, media. Look at this closely. We're up to $10,000. 68-year-old man presents to his physician's office with diffuse pelvic pain. X-ray of the abdomen is shown in the image. Which of the following would help diagnose the primary tumor most commonly responsible for these radiologic findings? This one's a tough one. I really wanted to put this higher up, but gotta throw some hard ones in there to make sure we keep you going. Pause if you need it. This one's going to be tough. This is the DRE, the digital rectal exam. If you know what cancer we are looking for, it is going to be prostate cancer. And unfortunately, prostate cancer, the most common cause of cancer in men, metastasized to the bone. If you've ever heard the BLT with a kosher pickle, BLTKP, in terms of breast, lung, thyroid, kidney, prostate, P for prostate, that is a very common one. And it produces osteoblastic lesions, which is what we saw in that image. Not osteolytic lesions, which would be faded away or punched out lesions or just radiolucent areas in the bone. Not osteoblastic, where it's thick and forming bony areas there. So you can read through the rest to figure out why the other answers are incorrect. But that one is a tough one. Really requires a lot of reasoning. You have to think of the cancer that you're looking for and where you would find the primary issue on exams, such as checking the abdomen, checking the skin for melanoma, checking the flank for kidney. And we are beyond halfway home. A 76-year-old man is evaluated for anterior hip and groin pain and is found to have a hernia. He's scheduled to undergo elective repair of an abdominal hernia that is easily reducible. During the repair, however, the surgeon sees that the sac protrudes directly through the external inguinal ring without coursing through the inguinal canal. Which of the following hernia types does this patient most likely have? be surprised, even in orthopedics, how many patients come in with hip and groin pain thinking that it's an orthopedic issue, and it is not. It is a hernia. I've seen several of these in my office, so you got to be aware of them. Pause if you need it, and there you go. It's direct. So direct inguinal hernias are very different from indirect, which are also different from hiatal, diaphragmatic hernias. There are various different ones. You can obviously read about it. For the sake of time, we're going to skip. Moving on up. $30,000. Long one here. 22-year-old college student presents to the school health service complaining of worsening weakness in his arms and legs. For the past day, he has also begun to feel weakness in his chest and back. He mentions that he thinks he had food poisoning earlier in the week, which caused stomach pain and bloody diarrhea. Physical exam reveals that deep tendon reflexes in his lower extremities are absent. His physician sends his stool to be cultured. The results show infection with Campylobacter jejuni. Which one of the following statements is most consistent with the disease process connecting the patient's GI infection and his neurological symptoms? This one's also a tough one. If you've known it and recognized it, you'll know it immediately. If not, you gotta really chew this one over. Pause if you need it, and there we go. So this is unfortunately GBS, Guillain-Barré syndrome. It's very devastating when it happens. Once you've seen it once, you remember it very well. Campylobacter is the initial issue, but then your body does this autoimmune response where it just basically makes a mistake. It thinks that your myelin sheath from your Schwann cells in your nerves are the infection and attacks your own body instead of just attacking the infection. There is an enterotoxin involved in Campylobacter, but that's not really the mechanism of Guillain-Barré. It's an autoimmune response. All right, we are moving up into the last tier here, $50,000. How are we all doing? Are you answering all the questions right? Getting at least some of them? Here we go. 17-year-old girl complains of a painful, swollen left elbow and fever. In the previous few days, her right knee was also swollen and slightly painful. The physician notices several oral ulcers and an edematous and tender left elbow. Lab tests are notable for a weekly positive ANA and anemia and positive VDRL testing. Although the patient has no sexual history. Which of the following is the most specific antibody for this patient's conditions? This one is another one that's a little bit challenging and difficult unless you kind of already know where this is going. You might not be able to get this one. That's why it's a high stakes question. The answer is no. Anti-Smith. This is lupus, unfortunately. There are some mnemonics out there, as you can kind of read here. Brain Soap MD. There's many other ones out there that try to help you remember the various findings. Lupus is a very fascinating disease process from a pathophysiology standpoint, and the physical manifestations of it are very varied. There's kind of variable penetration in terms of which ones. There's up to 11 different ones, kind of the older classifications here. They talk about this 4 out of 11 findings. There are much better lab tests now, but years ago, VDRL, which was also the lab test used for syphilis, unfortunately can be a false positive result in this situation. Rheumatoid arthritis and RF is another one. Rheumatoid arthritis can be positive in a lot of different conditions. ESR and CRP also non-specific and can be positive in a lot of different conditions and don't necessarily specify that the patient has that one disease. So this one is a tricky one. There's a whole other explanation here that you can read and learn about, but we're going to skip for sake of time. And here we go. We're counting down. We are up to $100,000. A one-year-old boy adopted, brought to the pediatrician for his first well-child checkup. Adoptive parents do not know any of the infant's past medical history or family history. Physical exam reveals an unusual widening of the child's wrists and ankles and marked enlargement of the child's costochondral junctions. What is a characteristic lab finding used to support the most likely diagnosis? Again, these are hard. That's why they're up at the top. Once you think about it and say, wait a minute, I think I might know this answer, you might get it immediately. The answer is, go. This is rickets. This is vitamin D deficiency. You can kind of read about the answer here and what happens, but we're looking for certain values going up and certain values going down in terms of your calcium, your phosphorus, your vitamin D. 1,25 dihydrocholecalciferol is the formal name for vitamin D in its final pathway as it gets metabolized. And you can kind of read the rest of the answers here why those are incorrect, but that one can be a tough one. Here we go, climbing up, last three. A 32-year-old woman is incidentally found to have a mediastinal mass while having a plain film x-ray of the chest performed. She subsequently reports that lately she has been feeling more fatigued, especially at the end of the day. In the office, she has difficulty rising from her chair to move to the examination table. On physical exam, the patient has asymmetric left-sided ptosis, a subjective feeling of blurred vision when reading the eye chart on the wall, and a facial droop bilaterally. Which test would confirm the most likely diagnosis in this patient? You may already know what's going on here. If you don't, it's a hard one. Unless you know it, then it's pretty straightforward. Yeah, choline. This is myasthenia gravis. This is a good one. Another hard one. Classic signs and symptoms if you know what you're looking for. Thymomas are the key in this one, the widened mediastinum there, if you go back to the image. This one can be tricky if you don't know it, but once you've seen it, you got it. All right, here we go. $500,000. Another long one. 42-year-old woman comes to the clinic complaining of blurry vision. She states that for the past 3 weeks, her eyes have been very dry and itchy, and she is unable to make tears. She also states that she has had very dry mouth despite drinking adequate fluids. Physical exam reveals bilateral dry ulcerated corneas, that's horrible, and fissures on the sides of her lips. In addition, both of her knees are erythematous and swollen. When asked about her knees, she says, yes, my knees and wrists tend to be swollen and stiff in the morning, and my mom had arthritis. Testing for several autoantibodies reveals that she is rheumatoid factor positive and anti-SSB positive. Which of the following is the most likely diagnosis? Again, rheumatology, classic stuff here. If you know it, you know it. Sjogren's. Yes, so this is Sjogren's. You can kind of read about the explanation there. Crest and other ones is kind of variants of a scleroderma and whatnot, but this one, once you kind of learn the phenotype of this, you should be able to figure this one out. Okay, here we go. Mother brings her 12-year-old son to the pediatrician's office because he is complaining of leg pain. The pain is located on the distal right tibia and has persisted over the past 2 weeks. The mother also notes that the child has had intermittent fevers during this time. On examination, the site is erythematous and swollen. Plain film x-ray is taken, the results of which are shown in the image. Biopsy of the site shows sheets of many uniform cells with scant, clear cytoplasm and no evidence of normal, bony matrix. That is key. Which of the following is the most likely diagnosis? Another really hard one. Pause it if you need it, and... So yes, this is Ewing sarcoma. Unfortunately, very terrible thing that can happen to a pediatric population. You can review all the different ones there and the reason why those were incorrect, but this is why this is a tough one. Now, some of you might have realized, yeah, wait a minute, that's only 14 questions. Yes, so I made one more to make it an even 15, because that would make sense. This is your all-in round. This is my special bonus question here. I may have been a little strict with this question, sorry, but it's got to be for the final round. 42-year-old woman has had increasing pain and swelling of the joints of her hands and feet for several months. It is becoming very difficult for her to perform common household tasks. A microscopic image of the synovium of the PIP joint in her hand is shown in the image. Which of the following laboratory serologic findings would most likely be positive in this patient? So some of you might recognize, wait a minute, this is a woman in the early 40s, sometimes happens in the late 30s. bilateral symmetric distal joint involvement, classically involving the MCPs and the PIPs, morning stiffness, and things like that. This sounds like rheumatoid arthritis, and you may have already answered that, and that's kind of the gimme part of this, but the trick is, what is the answer? Some of you may say, oh man, I remember learning this. Which part was it? Was it the IgG? Was it the IgM? Was it FAB? Was it the FAB? Was it the FC? The answer is, yeah, it's going to be D. The IgM, your body makes an IgM directed against the FC portion of IgG. So your body makes a rheumatoid factor, which is antibody complex, where your own antibody attacks another piece of another antibody. It's a really tricky one. So there you have it. That was a very tricky one. It wasn't enough to know that it was rheumatoid arthritis. You had to know that rheumatoid factor is an IgM antibody directed against the FC portion of a self-produced IgG antibody. That's what rheumatoid factor is. It's a really sneaky thing, rheumatoid factor. Look at this. How many conditions all can result in a positive rheumatoid factor, a false positive. So you got to be careful with RF. So there you go. How far did you make it? Whether you hit that millionaire status or just tapped out halfway, at least you just reviewed some really high yield concepts, and I hope you had a little fun doing it. If you enjoyed this format, please let me know. I'm going to be rolling out some more Millionaire rounds soon with new subjects and new question sets. So thanks for playing, and I'll see you in the next round.